Okay, so we're here with Kim Waters. Kim has a good story about the migraine headaches. Kim, how long had you been getting migraine headaches before you came in our office?
I started getting migraine headaches around the age of 11 and 12, and I'm 24 now, so that's over half of my life.
Wow.
I've had migraines, yeah.
Yes. And so can you describe the intensity of that migraine headache, what you felt like, what you had to do for relief?
It was very centered right here on my my left eye, right behind it almost, and the only relief I could get was either taking ibuprofen, and if I didn't have access to that and it got really, really severe, I would have to shut myself in a dark room and, take some medication and just wait for the medication to kick in.
Now, the migraines typically lasted how long?
Anywhere from 3 to 6 days, and I had to continually medicate myself because if the medicine wore off, it would just come right back. So, I just continually medicated myself for those 3 to 6 days.
And you had told me on the average you were taking how many ibuprofen per month?
About 45 pills of 250 milligram ibuprofen.
Wow.
On average, yeah.
Wow.
Sometimes more, sometimes less, but 45 is a pretty good estimate.
Wow. And now, since you've been treating our office for how long with the brain-based therapy?
I believe it's about 2 months now.
Okay.
Yeah.
And so when's the last time you had a migraine?
About 3 weeks after I started here, I had just a small, like the smallest one I've had in a really long time, and I haven't had one since, and that's, the longest I've gone without a migraine since I started having them.
Wow, that's pretty impressive.
Yeah.
Wow, that's great. Now, you had seen specialists and other doctors, and you told me that you were even, as a young kid, in a migraine study group, correct?
Yes.
And did that change anything at all?
No, they really didn't know what caused it. They just really tried to mask the pain, mask the symptoms so I could just live a normal life. But a lot of the times the medication they gave me made me feel worse or equivalent to how the migraine felt, just in a different way.
Right, got it. And these were so-called specialists, migraine specialists, migraine studies, and really there was no conclusion that they had no answer for you whatsoever.
They actually prescribed me glasses, and I didn't need them. My vision is better than 20/20, but I don't know. They still gave me glasses, so
wow.
I wore glasses for like 6 months, and I was like, why do I even have these? I see better with them off. So I stopped wearing them.
Right. And when you came in, were you apprehensive at all, or?
By the time I came in, I was just so fed up that I was like, if you can do anything, I don't care what you ask me to do, I'll do it. And if it gets rid of them, like, hallelujah.
Right.
So, to that point, like, the migraines had become more frequent. Instead of like once a month, they were becoming like once every couple weeks, every 3 weeks. And I was like, they just seemed to be progressively getting worse. So I just was fed up. I was ready to do anything.
So how's your life changed since you don't have migraines?
I don't have to really have that anxiety or fear that one might come along, and I don't have to worry about having medicine in my purse anymore in case I'm doing something and a migraine starts, so I don't have to worry about taking the medicine right away. I don't have to really worry about like having to miss work or school or anything because I don't have that fear that it's going to come anymore.
Wow. Now, if there's people out there that are watching this video, that suffer from migraine or debilitating headaches, what would you say to them? Having gone through what you've gone through and the relief that you've gone through, what would be your suggestion?
I would say come in immediately. You don't have to live this way. No matter what everyone says, the doctors say, this isn't something you have to live with. So, come in, get better, and your life will definitely change for the best.
Right. Thank you.